Good morning, live with Ligia.
Live with Kerry.
We are here Saturday morning coming live to you.
Yes. So welcome to the InTouch SS Healthcare channel where we talk about what we want. Exactly. Today we're going to be talking about Senate Bill 1373. Why? Because it's on the agenda for tomorrow, Sunday, Monday
morning.
It is on the agenda for Monday. And now it's a full schedule like the SB1373 was last year. So we're expecting some
Oh, wow,
unknowns.
that was all day.
That was all day. We didn't know who was going to speak. Many people were registered, but it's going to be something similar. So why are we talking about Senate Bill 1373? Because it's on the agenda. So let's go ahead and dive in and talk about it.
And it affects all of us.
Yeah, it sure does. But before we get into the bill, Kerry, you know, we've been working together for a while now. I would like for you to tell the people watching, the public, you know, our industry, how long have you been working in this industry?
Well, you know, I graduated. I've been a physical therapist for 26 years. I've worked in the home health industry for about 23 years. So I've gone in a lot of homes. I've seen a lot of our elderly in their homes providing care.
Wow. So we're definitely going to focus on residential care because that's what we're focusing on as far as the bill and how it affects us. But you've been working with older adults for way over 2 decades.
Yes, almost 2.5 decades.
Okay. And would you call caregivers heartless?
No, I would not.
Okay.
No, I would not.
Shouldn't have said that, but I said it.
No, I wouldn't.
Okay, so you know, I've been working in the healthcare industry here in Arizona since 2008 or 9. But what was your first initial setting that you worked in?
You know, I worked in, it was in Texas, and it was a state institution with older adults. Back then, there wasn't home health, so a lot of them were put in state institutions.
Oh, wow. Okay. Wow. I didn't know that about you.
Yes.
So I like to ask questions.
Yes.
So I worked in a skilled nursing facility in Orlando in 1999. Do the math.
Yes.
About 22 years. I started working in the senior care community. I haven't been in a large center in a really long time. My passion is residential care.
Right.
And it's one of your passions too. You're very involved in the residential care. And that's why we get along.
Yes.
Because we're always advocating for an industry where not a lot of people advocate for. It's just because they're individual, they're privately owned. It's hard to get so many people together to push for something. So there's so many advocates now in the industry for residential, you know, care communities. And I appreciate every one of you out there that fights for this industry and fights for, you know, for people in this industry. And, you know, a lot of people don't even put or post anything about it. They just go throughout their days and weeks and months helping other people. So I just want to show some appreciation for all of you that do that. Right now, isn't it like Female Awareness Month or something right now?
Yes, it is.
You know, so let's just do a shout out. Tiffany Wright, president of Passers. You know, you've been advocating for this,
Tiffany.
You know, for this whole industry for such a long time. Thank you for everything that you do. Daniela Kozma is the president of the Arizona Senior Advocates, I think. Arizona Senior Advocates.
Yes.
Daniela Kozma, you were initially in the beginning a part of ALHA years, 13 years ago?
Yes.
And now you have your own association that you're president of, and you've been advocating for this industry for a long time. And you were with us for the SB1373 at the House last year. It was chaotic, you know, but thank you for everything that you do.
Also, Karen Barno.
Yes. Karen Barno is part of the Arizona Assisted Living Federation of America, and she has worked so hard for years advocating for older adults. These organizations don't just advocate for the facility owners. They advocate for the older adults living in those facilities and in those environments. So Karen Barno, I mean, you know her better than I do, but I've grown to appreciate her over the time.
Right. And also Gail Dixon. You know, Gail was our president at ALHA for many years, and she's a vital part of a lot of the writings and things that we put out. And so, Gail, we just definitely want to recognize you for all the work that you've done over the many years that you've been a part of this. And
we do appreciate it.
Appreciate that.
And then we have Noor with All Hope.
Yeah, exactly.
Noor is on the east side of the valley, and she has been working with the facilities and older adults for years. She spent a lot of time at the house advocating too before I even knew it was a thing. Yes. And so now we have social media, and so for some of us that are advocating, it's a lot easier to ask for help. It wasn't the case for a lot of them. But a lot of you have called, throughout the years and, hey, can you help me? Can you inform me? Is there something you can do? Can you give me some information? We have a lot of people that you ask us, what does ALHA do for me? Well, right now, ALHA's fighting for this industry, and we need you guys to vote. We put up a survey on what you would do if one of your loved ones lived in assisted living. We sent out an email to all of our contacts in the system yesterday morning. So if you guys can go back and fill out that survey, we want input from everybody. We have older adults that have filled out this survey. We have family members that have filled out this survey. We have people in the public that filled out this survey. We have facility owners. We want input from everyone regarding what you would do if your loved one lived in assisted living. So it can give us some guidance on, some of the people in the public are accusing caregivers of not performing CPR and first aid. So based on the last year of me studying and researching state statistics, I haven't found that to be true, but that's why we're asking the community, is there something we're not seeing? Because I definitely don't see it, and I don't agree with it, and I don't think it's true, but we want to put the survey out there to hear what everybody is saying so that we're open to every side.
Right, and when we say we represent you, the only way we can represent you is for us to hear from you. So when we put the survey out, we take that information. And by taking that information, we know what you're saying, what you're thinking.
Yeah, absolutely. So please go back to that email. If you didn't get the email, then just drop a link below in the video and put your email, and we'll send it to you. And you can fill out the survey on your own opinions. Not too long ago, I was at the house, saying that, as a registered lobbyist, I'll put your email in and I'll help you vote for or against the bill. Now, I have my beliefs, and based on statistics, I like facts, and I like to follow the facts, and that's how I see truth, by facts. But if you decide to support the bill, then I still did register you. So again, even though I am partial to residential care and I have my opinion about it, we're trying to lean on both sides here and give the opportunity. But let's go ahead and move forward with what we're trying to talk about today. So last year, during the initial proposed bill, which is HB 2260, we had over 600 votes from facilities, from family members, from older adults living in the facilities, from everybody out in the community opposing HB 2260. So that has to stand for something.
Yes,
it has to stand for something. Unfortunately,
COVID happened.
Yeah, COVID hit. And so that bill, the time frame passed, and so it was reintroduced in January into the Senate as Senate Bill 1373. It was definitely revised, but this version we still have a problem with.
Still not to our liking.
Now, I think everybody can agree that caregivers need to perform CPR and first aid. In a cardiac situation.
Right.
We're not negating that in any way. It's the way the bill is worded that we all have a problem with. And we're going to try to, give some education on the bill and some differences between the facilities in Arizona.
Right.
So, who's opposing Senate Bill 1373 officially? So ALHA is opposing the way that it's written. Everyone's opposing the way that it's written. Everybody, as far as who we're going to mention. So the Arizona Assisted Living Homes Association. We have RALNA that just did a press release on how they're opposing because they're seeing similar legislation throughout certain states, and they're seeing it as EMS trying to take the duty of care off of them and putting it on the caregiver because it's too many calls. And that's how they're seeing it.
AZ Alpha?
AZ Alpha is opposing it. Leading Age is opposing it. ACA is opposing it. RACCAZ is opposing it. Passers is opposing it. So all of these major organizations advocate for the older adult. and they're all opposing this bill. I mean, we have to stop and ask why. They can't all be bad actors.
Right, exactly.
You know, these are people fighting for the industry and been in the industry for a very long time. AZ Alpha and Leading Age are involved in these type of bills throughout the entire United States.
Right.
And now they're involved in it in Arizona, and they're opposing the way this bill is written.
Right.
Now, who's supporting this bill?
Yes, yeah, who's supporting this bill?
So initially, HB 2260 was, was supported and brought to the state by a firefighter, and a lot of firefighters were there down in the basement when we were discussing the bill. This year, it's the same firefighter, but they brought the cities: City of Phoenix, City of Scottsdale, City of Surprise, City of Peoria, City of Glendale, to stand in support of this bill. Now, initially, if you look at it, caregivers need to perform CPR and first aid. We all agree to that. We're not denying that. But if you read the rest of the bill, and you read, unfortunately, some of the supporting documents, it's sad that we can't work together, that we have to try to implement legislation on an issue that's not really a big issue. There's already regulation requiring, here in Arizona, there are some states that don't require CPR and first aid on a caregiver.
But here, we already have the legislation.
Arizona's not one of them.
Right.
Exactly. So facilities can't implement policies prohibiting staff to perform CPR and first aid if the health department mandates it. And here in Arizona, they've already chosen to mandate that. So every caregiver licensed in the state of Arizona cannot obtain a certification without CPR and first aid.
Exactly.
It's already mandatory. Right. So I don't know what we're doing here, but we're going to go through the rest of the bill. So what's happened since last year, HB 2260? We're going to reference both of them because they're very similar, and they're proposed for the same reason. Last year we looked into it. I looked and read the EMS annual reports. I read all the supporting documents, and I couldn't find any proof to the accusations. But since last year, AZ Alpha, ACA, ALHA, and Leading Age have gotten together to work together to support older adults and the senior living communities in Arizona. And kudos to all of you for doing this.
Yes.
We work better as a team, and so thank you for that. I mean, we have residential care, we have independent living, we have ACA, which is the hospitals. We have assisted living, we have all the facilities, and anyone that touches an older adult. Right. So they're all working together. Also, we know that Gail at ALHA has reached out to EMS before to try to implement some educational programs, but residential care in many states are not important. They're not recognized because they're residential care. They don't provide medical care, and because there's not that many. Well, here in Arizona, we have, as far as assisted living homes, almost 1,800.
Yes.
And then there's over 2,000 group homes, and then there's foster care, and then there's adult behavioral therapeutic homes, and then there's group homes, which are DD homes. For those of you advocating for this bill, you should know the difference. And there's a different level of care for each facility.
I think that if the people who are part of this, if they knew the difference, this wouldn't be here. But
not like this.
But if they actually knew the difference between all the homes, then we wouldn't be sitting here right now.
So it's an education issue, which is what we were saying. This is an education issue, not a legislation issue. We're talking about falls. The thing is if we can prevent a fall, that's where we need to work together on how to prevent falls from happening. Because once someone is fallen, they need those emergency care services. They need those EMTs to come. So it's an education issue. How do we work together to prevent the falls from happening?
Right, exactly. Yeah.
Once an older adult falls, they're going to need emergency care in most cases.
Right.
So we don't want to take that away from an older adult.
No.
And another thing is, we reached out to I reached out to EMS. I went to their last public meeting, and we requested that residential care be included on the next public meeting agenda. And the reason why is because we want some of those statistics recognized and reported. Out of hospital incidents in residential care is not common in the state of Arizona. Now, there is a system for emergency services to use NEMSIS, but in Arizona, a lot of that data is not captured. So maybe this is something that we can pioneer and push through to where we can start getting some of those statistics for residential care settings. because as of right now, we can't, as individual facilities, we can't capture that data.
Right.
We're going to rely on EMS to try to capture that data for us. So maybe there is a way, and maybe other states have done it through the NEMSIS system. We're not sure, but we're on the agenda.
Yeah.
So that's a good thing.
That's a good thing.
Yeah.
Yes.
And then, one of the other things is we started a fundraiser for any facilities out there that don't have a Hoyer. We've had Hoyers donated, we've purchased Hoyers, and we're giving them out. So if you're a facility in the state of Arizona and you don't have a Hoyer, maybe a resident owned it and you didn't need one until now, or whatever the reason, it's not mandatory to have a Hoyer, but it is definitely, I wouldn't have a facility without a Hoyer.
Right, because you want to protect your caregiver.
Well, yeah, because I can pick someone off the floor that's heavier than my own ability if I'm by myself. So my facility does not require 2 caregivers at all times, nor does it require awake staff at night. My residents don't need it at the moment. Sometimes they've needed it and I've implemented it. So in my facility, I want to use a Hoyer because if I need it, I can use it. I'm not, I'm 100 something pounds, but if I need to lift someone that's 300 pounds, I sure can. And I will, and I have. So if you need a Hoyer, just reach out to us. Just write a link below, send me an email, send me a PM saying, hey, we need a Hoyer, and we'll try and get you one anywhere here in the state of Arizona. So we've implemented, some actions ever since we were made aware that there are some people accusing residential care of not providing. Go ahead. Sorry about that. Yes. I put it on Do Not Disturb, but it's still on. Sorry.
Right. So one thing, we've had a lot of questions from our community.
Yeah.
And, we people reach out to us and say, hey, this is going on. What can we do? And, one of the main things, the first thing was a video that was released not too long ago. And so have you seen the Right Care Foundation video? Would you like to?
Okay, so these questions are from the community. You guys have any other questions, feel free to write them. We're going to do our best to answer them. As far as the Right Care Foundation video regarding Senate Bill 1373, as a caregiver, as an ALF manager, as an aging specialist, as someone that's worked in the industry for over 20 years, I'm offended. I'm not heartless. I don't think I am. I don't think my residents think I am. I work really hard. I work very hard. I don't really care for the video that much. I don't think that the statistics are right. I don't think that I've been working this many years and so passionate about what I do so that someone can say I don't give dignity to my residents. I just think that, and I don't, I don't think that the founder of Right Care Foundation is a bad person. I know some people are saying that, maybe it's in the benefit of his own company to make money. No, I'm passionate about things and it has nothing to do with money. I just think that maybe his education on what we are and what we do and all the levels of care is not 100%.
It is sad that was.
So I don't think it's a bad. I don't think that that it's bad that you address an issue that is a concern of yours in the community.
Right, yes.
So as a firefighter, you may see some things that other people don't see, but that's why we have organizations, so you can reach out to us and say, hey, I see this as a concern. Can we talk about it? Unfortunately, we're not being recognized as associations and organizations. It's just being straight up to legislation.
Right.
And I do think that we should have a voice. So I don't really want to talk about the video.
Okay.
I don't really.
So
like
have
it.
you reached out to Steve Wagner?
Yeah. So even last year, we were able to kind of discuss a little bit. It's hard with the opposing party, to talk. It's just, it's a little awkward, but it's hard. But we did, and we thought we came to an agreement on some amendments last year, but then it completely changed. And then this year, I have reached out. Unfortunately, right now he's really busy. So maybe in the future, wherever this bill may go, we still want to create community programs and educate, the facilities and the public about falls and CPR. It's definitely a good place where, the focus is on. It's just, I think all of us should be included in it.
Right.
Especially since it's affecting us with legislation.
Exactly. This bill that they're having, will the bill from the state of Arizona, will it put the state at a higher liability if the homes get sued because of they didn't do CPR on a person? They didn't do it correctly.
Oh, okay.
That's what's kind of scary, okay, well, you did CPR, but you didn't do it correctly, so will you be sued? And if you're sued and you don't have the funds, what happens then? Or will something happen?
I'm not an attorney. I can't answer that. You need to ask your attorney for that answer. We do have some facts. The state of Arizona was liable in a recent case because the facility couldn't afford to pay for what the family was suing, and the state of Arizona was sued. So is it possible that one of the residential care facilities does not have enough money to satisfy a family member in case there's criminal negligence, or there is, you didn't perform CPR right? I don't know. You really have to, ask your attorney that. But it's a good question, but I don't know. I don't know the answer to it.
So another question: will the bill require CPR on residents who are having chest pain but seem to be having cardiac arrest but still breathing? And that's kind of weird because it said in the bill, and we'll reference a bill, it says cardiac arrest symptoms. And that's what's weird, because when you look up the definition of cardiac arrest and the symptoms, they're about, it lists usually about 8 or 9. And 8 of them, 4 of them you can look at it and it says, okay, the person is not breathing. But when you look at some of the other ones, the people are still breathing. So as a physical therapist, if someone's breathing, you can't do CPR on them. Okay, so this is a good problem. A good question, and it's a problem everyone's having. So it's not that we're negating caregivers need to do CPR and first aid. Again, we'll mention that a million times. It's the way this bill was written. Recently, I was told that I haven't read this bill. Well, I've read this bill over and over and over. And, and we've read everybody's versions of the bill and their amendments and their, suggestions. But this is what the bill says. It says that, a requirement is that you shall initiate immediate cardiopulmonology resuscitation before the arrival of emergency medical services to a resident who experiences symptoms of cardiac arrest or resuscitation of respiration. So that's where, it just needs to be taken off the bill, the symptoms part, because the symptoms, you can't perform CPR on someone that that's having chest pain. It might be heartburn. You don't. CPR is performed on someone that is not breathing, unfortunately, but it's not while they're breathing. So the symptoms of cardiac arrest, unfortunately, some of them you can't perform CPR on them. So it just needs to be removed off the bill. Okay. So also the bill's requiring emergency care by caregivers, which is...
What is emergency care?
Yeah, because it's weird, because we already established their CPR. So now what more? What is emergency care? Because, again, these are caregivers.
So we're trained in first aid and CPR on some emergency situations, but we're non-medical. Residential care homes are non-medical facilities, and the state of Arizona prohibits residential facilities from providing medical care. So we're going to have to talk that one through, or remove emergency care, because the bill is saying that that you can't implement policies to prohibit caregivers from performing CPR, first aid, and emergency care. Well, first aid and CPR is what we're trained in. I would remove emergency care. Personal opinion, but what is emergency care? How is it defined? And the health department prohibits residential care from providing medical care. So does emergency care fall under medical care? Is it just a part of first aid? I don't know. It's a good question, but that's why these things need to be discussed.
Yeah. And another one was, why are the non-medical facilities included in this bill?
I think that people just don't know the difference between a skilled nursing facility and a care home. A skilled nursing facility, you provide medical care. You have a nurse on staff at all times. There are no nurses on staff at non-medical residential facilities. It's a home for a resident that can't afford a large center, or can't perform activities of daily living. It's their home. It's not an institution, a large institution. So I don't know why they're included. I personally think that residential care should, not be involved in this bill the way that it's written, because of emergency care. So I don't know.
And that's kind of like the same next question. Why are facilities with medical staff and residential facilities, caregivers, being thrown into the same bill? I think,
yeah,
excuse
I think
me,
I just
the
answered
lack
that
of
one.
education from the
From
bill
a lot
writer.
of, just from the public, unfortunately. Residential care settings are becoming more and more public because of social media, and an option for older adults because they can't afford, anything more than that, So I can't give you guys a straight answer for all of these, but we can give you some facts and some information. I don't know why a skilled nursing facility. See, I'll give you an example. So one of these supporting documents to this bill is an EMS report from Scottsdale. Now, I've read almost all the EMS reports to try to find some statistics saying that caregivers don't perform CPR. But the Scottsdale report doesn't mention residential care at all. We're not included in these statistics. And this is one of the supporting documents for Senate Bill 1373. So we're not in here. Skilled nursing is included, for some of the reports. But again, I don't know. We're not included. So people just need to understand the difference between.
But this affects us a lot, but we're not included in that.
Well, that's why we're trying to prevent Senate Bill 1373 from going forward until we can sit down and discuss it with the legislative parties, with opposing parties, with healthcare professionals. We have to sit down and discuss this. So we can say, well, you know what? Okay, but maybe this needs to be written differently. Maybe you need to address skilled nursing and you need to address residential care and assisted living, separately or differently, So it's just. It's not a good bill to get passed through.
You can't write a one-size-fits-all bill because
not in healthcare, not in this.
And I think that's the problem.
Yeah, we provide different levels of care, and we're already mandated by the state of Arizona not to provide medical care. So, a bill that might be passed that can be interpreted that we're going to provide medical care. I mean, can we get a 4-year degree overnight or become EMTs overnight if this bill gets passed? That's a question. That's a legitimate question. Now, I know that when we ask this question to some people, they roll their eyes at us. That's not the case. Actually, it is. If this bill gets passed and requires caregivers to provide emergency care, to what level, to what standard, will we have to require more education? Will the state have to implement new education? Now, we already know we're going through a caregiver crisis and have been for a couple years now.
Yes.
And then we're going through a pandemic. We've had caregivers that have died from COVID-19. We've had residents that have died from COVID-19. It's hard to find caregivers right now. On top of the shortage, the pandemic, and now the fear that caregivers are saying that EMTs don't respect them. I don't think that's the case, but we need to be really cautious about this bill and what the repercussions of it passing will be. We don't know at this moment because the wording is so, in some cases, too vague.
Right.
In some cases, not specific enough to each facility.
Right. The last question that we have, and this, I won't say it's the saddest, but we've heard this a lot. Why is the state of Arizona trying to take away the rights of older adults to emergency services in the care homes? I mean, it's their homes, not institution. I'm sorry, it's their homes, not an institution. So, we hear that. I think on the press release that came out this morning, it even from Rana, it even talked about that also. And so I think everybody's feeling that.
Yeah, I think that sometimes you can get so passionate about a topic that you don't realize everything else that's happening around. And there's nothing wrong with being passionate about CPR and first aid, and nothing wrong with being passionate about older adults. Many of us are. Advocates are usually passionate people about something they believe in. Unfortunately, Ralna has also mentioned a press release this morning how many states are talking about legislation about a topic to where EMTs are wanting to put the duty of care on caregivers because they're tired and have too many calls. And I don't think that might not be the case here, but that's how people are seeing it. A lot of people are saying, well, why are EMTs wanting to take away that right from the older adult and not provide the same emergency services while they were living at home? That's a good question to residential care facilities. Like, if a resident lives at home or in a residential care facility, it has to be treated the same because it's a home. It's non-medical.
It's where their children to live.
Absolutely. So caregivers rely on EMS services to be able to have that resident in the facility. If the caregivers don't have the same ability as the public to call EMTs and EMS services, then, you know, we're putting the lives of older adults at a greater risk.
Right.
You know, misdiagnosing an older adult is a high percentage overall, and we don't want to be a part of that statistic. And putting that on a caregiver and taking that from an EMT, I don't think is the right thing to do. And that may not be the goal of this bill. I don't think it's the goal of the bill.
Right.
The goal of the bill is to make sure that caregivers are performing CPR and first aid, which is already mandated in the state of Arizona. Some states don't require it. Some states, you know, do not require any facility to do CPR and first aid. It's based on their policies and procedures. That's not the case in Arizona. Now, independent living facilities, for those who may not know, are not necessarily required to perform CPR, because it's like a tenant being required to perform CPR on a landlord on their tenant. Independent living doesn't provide care. You know, it's housing. So they're allowed to have a no-touch policy.
Yes, okay.
That's different because it's landlord-tenant situation. They're not providing care. But I don't know of any no-touch policies in the state of Arizona. The CMS and you know, Medicare does not allow any no-touch policies on any Medicare-approved facilities. That's already a federal regulation. There's a federal regulation stating that you can't do a no-touch policy. So in the state of Arizona, that's not the case. And you know, if there is someone not performing CPR, you know, if there's some bad actors out there. Now, I can tell you, in my years of working, you know, with older adults, I don't work just with the facilities. I work with older adults. I answer their calls on a weekly basis, concerns, information, whatever they're requesting. And I have never heard of a caregiver not performing CPR here in the state of Arizona. So I don't think it's a major issue. If it is an issue, and we're paying attention, if it is an issue, then it's the duty of the medical professional that's there or the ALF manager to report that neglect. You know, if there's any caregiver...
Whoever's there.
Yeah, exactly. Yes. If there's any caregiver that abuses or neglects an older adult, it needs to be reported.
Yes.
You know, that's the system that we have to follow. So if there are some bad actors, you know, it's unfortunate and we're sorry for that. But it doesn't mean that all caregivers are like that and that we're heartless. So moving forward, we will be there on Monday. We're going to ask for you guys to fill out that survey for us.
Please do.
This is a very passionate issue for us, and we take care of older adults. So we're going to fight for their lives. And, you know, in residential care, it's if one of your residents gets sick, we're all affected.
Yes.
You know, it affects our bottom line. It's not just about money. We're all affected. We can't, some facilities can't afford to lose that resident.
No,
you know?
not at all.
It's what's putting bread on their table. So you better believe we're going to fight for them. In residential settings, it's intimate. There's a lot of one-on-one. And that's why we're so passionate about this bill, because I do feel like a lot of people don't understand what we do. And how we do it, and how we're already regulated, and what we're allowed and not allowed to do, and we have to depend on the community. We have to depend on mobile physicians to come and help with residents, because sometimes they can't go to the doctor. We have to depend on home health and hospice to do therapy and end-of-life services. We can't do those services, and we depend on emergency medical services to help our older adults in an emergency. Now, we're not negating that we need to perform CPR and first aid, but we need to work as a team.
Yes.
So, again, Senate Bill 1373, yes, I'm very passionate and emotional about this bill.
Yes, she is.
You know, we had some proposed amendments going forward, and we'll see on Monday what's going to happen with this bill. I'm not asking you guys to come down to the House with us. That's not easy, but we're asking you guys to, you know, submit that survey and give us some information on what you would do as an individual.
Yes.
So thank you again, everybody, for watching. We know it's a Saturday. Sorry about the interruptions. We're human. But we want to know your input.
Yes.
Tell us about what you think, and please be involved in this bill. We're asking you guys to be involved in this bill. We need your support. There are 1,800 facilities, residential assisted living homes in the state of Arizona. We're all called something different. The AZDHS calls us assisted living homes. The NCIA board calls us assisted living facilities. Medicare calls us home-based community services. The city calls us group homes, but AZDHS defines group homes as developmentally disabled homes. So there's a lot of terminology that is is not working together in the state of Arizona, and so it's hard for the public to understand what we are. When our own
we don't know exactly.
Well, we know.
Well, when we know, but yes.
Yeah, so I understand that, but maybe moving forward, we'll have an opportunity to work together to create some community standards. If CPR and first aid is an issue to firefighters, let's work together. Let's create some programs.
Right.
If excessive 911 calls is a problem, let's do what some other states have already done, and they implemented fees on some of the facilities if they called too much. Right. Now we know that there are older adults that excessively call 911. Now EMTs can't get mad at them for that. They need to respond. Their scope of service and their scope of practice says that EMTs, have to respond to an emergency and non-emergencies. Right. So we appreciate it. I volunteered for the Glendale Fire Department, and I respect EMTs. But now I'm a care home owner, and I'm going to ask the public and people voting, with or against this bill for the same respect for our industry.
And if you have the older adults that are making these phone calls, again, going back to those reports. What's done with that information? Because if you've got that, how do you educate?
We have to educate them. You give them information. Right. You give them a phone number. You have someone follow up with them. Right. If they're excessive calling, if they shouldn't be living at home because it's not safe anymore. Right. You educate, and we're asking for that same opportunity. We want to educate if there's an issue.
I know some of the fire departments, they talked about having social workers, so that the social worker says, Mr. Johnson's called 10 times this week. Maybe we need to call Mr. Johnson's doctor. So someone could be calling that doctor to figure out why he's calling.
Yeah, absolutely.
But
EMTs have a lot of responsibility.
It's education.
And residential care homes have a lot of our responsibilities too. But yes. I think we should work together to make it safer and a safer environment for older adults in any setting.
Right.
So thank you.
Well, we thank you for your time this morning.
Absolutely.
And be praying with us because we need your prayers also. Thank you.